Hello, I'm Dr. Sarah Neal and I'm an Associate Professor in Children's Nursing at the University of Northampton. Over the last 10 years I've been doing a lot of research with parents to help us to understand better how they manage when their children are sick at home. And the findings I want to share with you today are about the impact of criticism on parents' help seeking when their children are ill. In the early years of a child's life, every parent will come across this dilemma. Do I, don't I seek help? Is my child seriously enough ill to need help right now? Or is this a sign of a more serious illness that will develop later? Or is this something that's going to go away on its own? Parents are trying to balance doing the right thing for their child with doing the right thing in the eyes of those from whom they seek help. This is quite difficult to do. They're worried about missing serious illness, but at the same time they don't want to use services inappropriately. They know that they're expected to use the right service at the right time for the right level of illness. And this father puts it quite simply. He says, you don't want to waste their time and you don't want to harm him. It's a fine line. And it is very difficult for them to balance the risks. If they get it wrong, what they say to us is that what they then experience is criticism from the people from whom they seek help. So why do they worry about seeking help? Well, it is all about that criticism. And none of us like to be criticised, so it's not really surprising that parents would want to avoid it too. And for them, we have found that the desire to avoid criticism, felt or enacted, is the primary motivator for their decision-making in acute childhood illness, apart from parents' obvious concern for their child's health. Such criticism leaves parents feeling that their moral character has been judged and found wanting. Some parents tell us that it also affects their self-esteem and their confidence in caring for their child independently, so it affects their self-efficacy. And they all tell us that they will use strategies to try and avoid that criticism. So what is this thing called felt or enacted criticism? It happens most often in their interactions with healthcare professionals, and that is most often felt criticism, which is perceived and communicated through healthcare professionals' attitudes. It's their non-verbal communication. It might be the tone of voice, it might be their facial expression. So for example, if you're seeing a parent with a sick child and you're thinking, actually they don't really need to be here, and you're seeing it as an inappropriate use of the service, that will probably be in your facial expression. And the parents will pick up on that. Parents are very sensitive to being judged by others. Enacted criticism is simpler. It is simply direct verbal criticism. It happens less often, but it certainly does happen. So this South Asian father said, you actually feel that, the doctor says, oh, this is really minor and you didn't really need to come here. And this mother from the white British community said, we've all taken a sick child to the doctor only to be poo-pooed away. Calpol for the next 2 days and the child will be fine. And then you feel silly. So I think you get a reluctance that builds up. And there you begin to see some of the consequences of these experiences of criticism. Now, such criticism is not just verbal or in non-verbal communication. It's not always just in those one-to-ones with healthcare professionals. It's all around us in the visual information that we're being given. So, for example, these adverts about the Choose Well campaign, which extort people to use the right service at the right time. So 999 is only for life-threatening conditions and emergencies. And these from GP services websites. Before you make an appointment to see your GP, consider the alternatives. Please think whether an appointment is really necessary. Please do not ask for an urgent appointment unless it is really necessary. These feel a little bit like a teacher in school telling the kids off. And I'm sure that's how it comes across to parents too, because they talk about this as having a negative effect, feeling that they're being criticised and they haven't actually done anything yet. If we look at this thing called felt or enacted criticism in a bit more detail, what we find is that it has 4 components. The first of which is labelling. Parents may feel they've been labelled for being an immigrant, a neurotic mother, a gypsy or a travelling family, or a young parent. What it does is it means that these parents are deemed to be less competent than others, and it means that their child's illness is likely to be taken less seriously. So you can see the impact in terms of them being able to present with signs of deteriorating child. All of these result in the parents being characterised as less competent than another parent. And they tell us that the illness they're presenting in their child is less likely to be taken seriously. And this, of course, begins to highlight the concern when we're trying to spot the deteriorating child. The second characteristic is that of discrediting attributes. And this tends to relate to when parents have breached informal social rules. And these are those rules of everyday life that tell us how we should behave. They're not the written rules, they're those unwritten rules that somehow you have to work out. Parents talk a lot about worrying about overstepping the mark, and this happens in both primary care and in hospital situations. The third characteristic, discrimination, is not reported to actually happen, but it is feared. People worry about it affecting their child's care, as this mother has said. The fourth element, unequal power, relates to our social hierarchy, and it's perhaps not surprising that it occurs here. Where the social distance is greater, there's greater unequal power, and the impact of that is on the parent's ability to raise issues with the healthcare professionals and to talk freely with them about their child's illness. So, what are the other consequences of filtering out of criticism then? And this is about those strategies that parents choose to use to avoid criticism. Some parents may choose to keep quiet. There's a quote from a mum here where she says, "You are sometimes afraid to say things to nurses in case Steve's care would be affected in any way. You don't want to be labelled as a fussy or a demanding parent." Others might delay seeking help. "I'd left it too late, and I was made to feel amazingly silly for having not done anything. Luckily for me, his last, gasps of breath were while he was sat on the GP's knee, who'd already called an ambulance. And then I felt terrible because I hadn't taken him to the doctors until he got, quite serious. So you can't win." So this British mother was talking about that dilemma of trying to manage it herself. She knew she was meant to cope with minor illnesses herself. And because she'd held on to it, and then when she presented when her child was more seriously ill, she was told she should have come earlier. So as she says, you can't win. Others will choose to use alternative sources of help. These may be advice from non-critical sources such as family members or lay experts. It comes with its own warnings though, in the sense that that advice may not be accurate or reliable. Alternatively, they might seek to use other services where they're not known, where they feel they haven't already been labelled and where people are therefore more likely to take them seriously. For example, emergency departments. So what can we do? Well, I believe we can spot potential sources of criticism by listening actively to parents' concerns, by showing them we really want to hear what they have to say and that we value it. We can then increase awareness of our own and parents' non-verbal communication in consultations. We can look at how they're responding to what we are saying, and if we feel that this is being perceived as a negative criticism, then we can change our style to create positive learning encounters for kids and their parents, which inform them about childhood illness, tell them what to look for, tell them how to care for them, and therefore empower them to look after their child. So as a result, we can help worried parents spot deterioration and seek help without fear of criticism. After all, we really want them to be focusing on their child's health and that what they need to be able to help their child and to seek help for their child appropriately, not to be worrying about what we might say when they seek help. I hope today's presentation has given you some food for thought and perhaps a few things to reflect on with respect to your current and future practice. If you'd like to get in touch or you have any questions, do please contact me on my email address. Thank you very much for listening.